David and I were lucky enough to go to Thailand and to the temple of the Golden Buddha and assist, or we were allowed to watch how the monks who were working in the Thai traditional medical paradigm were able to treat people, and it was almost equally physical. There was some bloodletting and spiritual, as well as there was much blessing and a lot of spiritual administration as well. And so the two paradigms have complementary aspects that can be brought together. You've heard me be critical in the past about the shortcomings of Western medicine. And largely that centers around the idea that we really don't do anything as doctors in our society until someone is past the point of having a problem and they're into dire straits. In other words, we see you after you had the heart attack, not during the 20 years while you were building up plaque in your arteries. We see you when you have a stroke. We see you when you've got problems with your bowel that is already well ensconced. And so ours is a sickness model more so than a prevention model. In Asia, most of the treatment that is required comes about because of the challenges of the environment. We die, you and I, because of the way we live. We die because we eat badly. The Asians do not eat badly. They have for centuries looked at the foods that are available to them, and they have determined which of those foods are going to bring about the greatest benefit, and they eat accordingly. If everybody in America kept eating for the next century the way we have been eating for the last 40 years, there wouldn't be an American nation. We would all die. We have horrible problems with obesity. Half of us almost will die from cardiovascular complications. Cancer rates are enormous compared to the Far East. Now, there are some cancers which are affiliated with hepatitis, infectious hepatitis, that are higher over there of the gastrointestinal tract. But when you take a look at all of the other cancers from which we suffer, you find those cancers only in people in Asia who choose to live and eat the way we do. So, what we do well is that we can intervene in trauma. If, for example, I were in a car accident tomorrow, and they drag me out of the wreck and are putting me on a stretcher, the first thing I'm going to ask for is not going to be a bottle of XanGo. I want to get to the emergency room to have the intervention that is so good in this country. We save people who would die anywhere else. And so the advantages are there. Now the disadvantages are that we tend to treat with drugs, which have all of them side effects. Ideally, a drug would go into the body, intervene in one single enzymatic process, and nothing else. But those kinds of silver bullets just don't exist, and we unfortunately have side effects from our drugs which are problematic. But we're good in the lab. We can take a natural product, and I'm going to make reference to green tea here, and we can break it down into its constituent parts and analyze exactly what those individual elements will be available for in the human body. And in our newest product, Eleviv, which has been developed by Dr. Talbot, we have taken two elements from the green tea. One from the immature plant, the L-theanine, and one, the epigallocatechin gallate, from the catechin portion in the mature plant. And we've been able to extract that, knowing that we will get benefits. So there's the advantages of the Western system being applied. Then, we take in that same product the Buricoma longifolia, which is a root from Asia that has been used for centuries, and we put that in there to give us the benefits of this long traditional Thai, which, by the way, I think that centuries of experience equal randomized controlled double-blind trials. They're just as important. Thank you. Now I'm completely lost. What am I supposed to be saying?
You're done! Woohoo!
Wait a minute. Sometimes I like to disown them. So what we've done is take the mangosteen, the whole fruit, the very best that Oriental medicine has to offer because it has such a broad application. Remember, in our paradigm over here in Western medicine, we want something that goes in and just does one thing. In the Oriental medicine, the better the product, the broader the effect of the product, the better the product. And so the mangosteen is the epitome of what you would get in the best of Oriental medicine with centuries of tradition behind it. Now we're bringing in excellent scientists who have the best of what can be found in the natural products industry, where we apply our laboratory expertise to bring to you things that are complementary. I think your company does it better than anyone else. Thank you.